Hi everyone, Vijay here. Today I'm joined by one of our clinicians, Daniel. Some of you who have attended Luton will know Daniel already, but I just wanted to have a chat with him and share some thoughts and let him know his background, who he is and what he does here. So Daniel, thanks
Hi,
for
Vijay.
joining me today.
Hi.
So how long have you been with us at
So
21D?
it's about 5 months now.
About 5 months now. What were you doing before this?
Just general dentistry, fillings, root canal treatments,
You keep
couple of
saying just,
extractions.
but we need general dentists in the world, you know,
Yeah,
because we're
Yeah, we
trying to
definitely
avoid
need
them
to.
ending up in front of us. That's what we're trying to do, right? Although there are plenty for whom it's unavoidable, but we're trying to avoid. So we need our colleagues, the general dentists. There are a lot of use. So you were doing that, and why us?
I thought that I want to make a difference to a lot of people that I was seeing on daily basis in my practice. They needed this kind of solution that we offered to them, but I wasn't properly trained at that time, didn't know about the existence of this kind of solution on Earth. So then Googled, found the job and found that, yeah, I can see myself in that company helping the people that I wasn't able to help during my general dentistry.
I'm fascinated by what you said because you're a newer graduate, and I would have thought at university there would have been a lot more emphasis on what implants can do for patients. Was there any of that at university for you?
Not really.
Not the whole 5 years?
No, it was just about 6 months regarding the implants and even bad advices regarding 2 implants for 1 tooth.
2 implants for 1 tooth?
Yeah, I was like,
Okay.
what's happening on Earth?
Okay, yeah. No 2 implants for 1 tooth. That's insanity of the highest order. So then you went into general practice. How many of the patients, the kind of patients you see now, were you seeing weekly when you were in general practice?
Yeah, about 50% of them needed our solution.
Needed our solution?
Yeah, for long-term stability and regain all their confidence, smile and their function, the most important.
And what about the disease load in the mouth that you were looking at?
Yeah, it was insane. So the amount of bone loss and all our like deep cleanings and all this stuff didn't help. Like 99% of the patients, it didn't help.
It didn't help. It's something both of us, we hear a lot from patients who say things like, well, you know, I go for deep cleanings every 3 months and it's still getting worse.
Yeah.
You know, I'm going to launch soon some, just for the group to read, the definition of advanced periodontal disease and how much bone loss needs to happen, because currently stage 3 and stage 4 bone loss, stage 3 and stage 4 advanced periodontal disease is considered anything over 33% of bone loss. Obviously there's a multitude of other factors, but how many patients did you see that had more than 33% bone loss everywhere?
I don't know in numbers, but I think loads of them.
Loads of them?
Yeah.
Were you, your colleagues, or any of the patients even aware that this kind of solution is even possible?
No, nobody of us knew about this kind of solution.
Okay, that's a real problem that we face. What did you guys, you said you were advising deep cleanings?
Yeah.
Okay.
To try and keep everything stable.
Stable.
Yeah.
There's no way that it would get better.
No.
Just trying
Definitely
to stop it getting any worse.
Yeah, yeah.
And did any patients ever give you any feedback about how painful some of these deep cleanings were?
Yeah,
yeah.
Definitely.
What was the general feedback?
So
I
don't want to come again. I'm never gonna do that.
Okay.
So, yeah.
Okay. But if you contextualize that against the corrections that you've seen, because you're also looking at not only new patients coming in, but you're also seeing patients at annual maintenance who've been stable now for a few years.
Yep.
And you compare it to when they first came in, what do you think?
Yeah, it's a huge difference between how it was and how stable and how happy the patients are. And even the general health is so good. So actually there are some patients who are asking me, let's make a survey on patients group for patients who have this done more than a year ago.
Yeah.
So we can tell you guys how do we feel, like generally
Actually,
speaking, general health.
This is a brilliant idea. I mean, I've anecdotally definitely dealt with this for 26 years because they all look and feel a lot better than they did.
Yeah, yeah.
All of them, like every single one. I don't know anyone whose health has gone south after we corrected them because of what was going on in the mouth.
Yeah.
It's always goes up, definitely. So yeah, that's a very good point, actually. We should look into that. And now you're here. And in 5 months, you've seen how many cases? Hundreds?
Yeah, definitely. Yeah.
High hundreds? Yeah?
Yeah.
Lose
yeah.
track, it's daily,
Yeah,
every day,
yeah,
all the
it's
time.
Day in and day out.
So I would hear this thing, right, from some of my, let's say, older colleagues my age. They'd say that things like, for younger colleagues to understand this, they'd have to do it for 20 years. Is that true?
No,
Right,
that's
okay.
definitely not true.
Okay. Because we do it day in, day out, and you see it all the time, and it's incredibly logical,
Yeah, it is.
how long do you actually need if you're in an environment where you see it day in, day out?
About 3 months.
About 3 months?
Yeah.
And it was then ingrained in your brain. So we had an interesting chat earlier about this. And one of the things that we talked about on that chat was about, you keep talking about it being better and stable. When you look at the gum health that you are seeing, I mean, I used to say this thing to patients, right? The last time your gums looked this healthy, you were probably 4 years old, right? That's what I see at gum level, right? I don't know what patients are looking at because they get paranoid about all kinds of things. And I keep looking at the gum tissue and I'm going, you've not been this healthy at gum level since you were 4.
Yeah.
So anything from that point onwards was shit compared to what I'm looking at today.
Yeah.
You know, so I understand they get paranoid about food getting stuck and all this stuff, but do you see any clinical evidence at all that there's any active disease issue on any of them?
Not at all. Zero.
Right.
Zero.
Okay, but how much reassurance do you have to give them? You know, when you take your photographs and put it up on the big screen and say, look, it's healthier than my mouth right now. Because a lot of I tell them this, your mouth, I've got all my teeth, but your mouth is healthier than mine right now. That is a fact.
Yeah, definitely.
Okay? So you're right about the general health improvement. You're seeing it for yourself. And tell me, for you, what do you see as the future, not just for yourself, but also for us as clinicians, now that we know we've got something this effective to deal with advanced periodontal disease?
So we definitely can treat most of the patients who need us, and we can offer them a stable long-term solution to be pain-free, disease-free, and live their life at full.
And do you see, just from the evidence that you've looked at, not just from the 5 months that you've been working here, but you're also looking at the data of patients who were rehabilitated 3 years ago, 2 years ago, whatever. Do you see super stable bone health, super healthy gum health, such low bacterial load in the mouth, it's beyond a joke?
Yeah, we always compare the X-rays taken on long-term prosthetic fitment and then on annual maintenances, so there's literally no bone loss seen on the X-ray.
Right, and no bone loss, no bleeding, no pus, no
Nothing.
indicators of active disease in any way, shape or form. But in terms of predictability, do we actually have anything in dentistry where you can service an entire jaw by just taking off 4 screws, sort of looking at it, giving it a bit of a clean, and then putting it back in?
No.
Right,
No.
okay. That's the bit that always gets me, because I keep saying, you know, if my own teeth were unscrewable, so I could literally take them out, maybe chuck them in a dishwasher and get it fixed and then pop them back in, it'd be great. But we can literally think along those lines now, and you're seeing great outcomes, correct?
Yeah, the best ones.
Yeah, the best ones. That I agree with. Yeah, that I agree with. So for your own future, what are your aspirations for this? What do you want out of this as a dental professional? What do you want to see more of?
definitely like for us to help more and more people, not only in UK but on the whole planet Earth, and get their health to a better level, and especially something stable for them.
I think one of the things that we're going to have to address as a team is we're going to have to start by helping the profession and helping the teaching institutions to understand that this is a reality today.
Yeah.
We can do this today, and it should be considered as one of the options for advanced periodontal disease as a standard, or at least the patient should be told. The affordability issue is not a clinical issue, it's a patient issue.
Yeah.
We need to tell them that there are these possibilities. It's not really my fault that it's not freely available on the NHS, you know, but it does exist, and at least have patients have the ability to research it for themselves, rather than, so I don't disregard deep scaling, but there is a point at which you just go, okay, we're wasting our time here, right?
It is.
But equally, even if you're going to start down that road with the patient, at least give them the other side as well and say there is this option if this does not work, and quickly.
Yeah, exactly.
Don't not tell them. Would you agree with that?
Yeah, 100%.
Great. Okay. So yeah, Daniel, everyone, you'll see him in Luton, more than likely, correct?
Thank you, everyone.
Thank you very much. Thanks for your time.